Welcome back, everybody, to episode number 2 in my weekly series reviewing the latest news in sports medicine and sports injuries. I really appreciated the feedback I got from the first episode of this, and so hopefully I'll implement some of those changes and keep on making this better for you guys. I've covered a number of things since our last weekly video, in particular Drew Brees and his thumb injury, Ben Roethlisberger and his elbow injury. We talked about compartment syndrome in a UFC fighter, and also reviewed Trevor Siemian's ankle dislocation. In this week's rundown of injury topics, we're going to hit on everything from concussions in the NFL. We'll talk about soccer and what's going on with Alex Morgan's knee, some more baseball injuries that we've heard about, and then of course we'll give some updates on stuff from recent videos. One of the key pieces of feedback was to give a better timeline of what I'm going to talk about so people can skip ahead if they want to see specific things. So I'll still have the links in the description below if you want to click to jump ahead, but I'll go ahead and throw up here over on the side the kind of full rundown and timestamps of where we're going to talk about our different topics before going back to my traditional method and kind of putting them up here running along the screen. You'll notice too my lighting's a little bit different here, and so let me know below if you think this is better, worse, or what you might recommend. As always, go subscribe if you like this type of content, want to stay up to date with future videos, and let's get started. Starting off this week in the MLB, we got some updates regarding Mike Trout and his Morton's Neuroma. I talked about this in last week's rundown, and at the time he had undergone a cryoablation procedure to try to freeze away that nerve. Well, as I mentioned in that video, sometimes this doesn't always work, and as you might have heard, he's gonna have to undergo surgery to actually get this thing excised and cut out. There's still some decisions to be made though about what specific approach and type of surgery to do for these. In general, there's 2 accepted approaches, one where they go through the top of the foot, called a dorsal approach, and the other where they go from the bottom side of the foot, which is a plantar approach. There's pros and cons to each method. If you go from below the foot, there's more risk of scar tissue and it's gonna take longer to initiate rehab and get back to weight bearing, but you have decreased risk of something called a nerve stump, which can be a painful residual sort of stump at that nerve that's been cut off. On the other hand, if you go from the top, you can often weight bear much quicker and start rehab much quicker, but you run a bigger risk of developing this more prolonged thing with this nerve stump where it can be more long-term pain. Even though this is surgery, there is still a chance of these recurring. Some of the research puts it at around 14 to 21% recurrence rate, so even if he gets this surgery, there is still a chance this is something that could return next year and be a more persistent issue depending on how the surgery goes. They basically just go in and cut out the piece of the nerve that has the neuroma formed, and so you're dealing with scar tissue in that area, you're dealing with possible structural instability in the forefoot based on what you have to cut through, and then of course a risk that it could return in the piece of the nerve that's still left over. Sticking in baseball, moving on to Shohei Ohtani, news came out that he's gonna miss the rest of the season to undergo surgery for something called a bipartite patella. This is a very rare condition that happens during development where the individual pieces of the kneecap, while they're forming and growing, don't actually fuse together to form one solid kneecap, so you essentially end up with 2 isolated sections of your patella. This only occurs in about 2 to 3% of the population, and when you see it on one side, you've got about a 50% chance of also having it on the other. We don't have official word if this is something Ohtani has on the other side, but the report is that he was dealing with this a lot throughout the season, and it finally just got to a point where he couldn't take the pain anymore and had to get it corrected. Most of the time when people have these, they're completely asymptomatic, meaning they don't cause any long-term problems or pain. But if they become symptomatic, the belief is part of the pain comes from the portion on the outside being pulled away because of the lateral muscles and the lateral stabilizers just trying to pull apart the kneecap. There's 3 different types of bipartite patellas. Type 1 is where it's the inferior, the bottom pole of the patella that's separate. Type 2 is the lateral portion of the patella that's separate. And type 3, which is the most common, is kind of the upper and outer corner of the patella that's separated. There's a number of different surgical options they can perform to correct these, but the most commonly accepted one is actually opening up the skin, going into that tendon and basically pulling out the extra smaller piece of kneecap. There are other things they can do with the soft tissues around the kneecap where they try to limit the amount that patella is being pulled out laterally, but just simply opening up the knee, going in there and removing that extra piece is what's most common, and these have pretty good outcomes. Sticking with the patella, but moving on to a different sport, Alex Morgan is gonna miss the rest of the season because of a stress fracture in her patella. Now, this was an injury that was reported to have occurred back during the World Cup when she might have had a collision or made contact with another player, but was something she's been dealing with for a while before it's gotten to the point where she has to just sit out and get this fixed. Stress fractures in the patella are an extremely rare location. Around only 1% of all stress fractures in the body occur in the kneecap. But think about what the kneecap is being subjected to. It's a sesamoid bone, meaning it sits inside the tendon, And so on one end, you've got the big quadriceps tendon and muscle pulling it up, and then on the other end, you've got the patellar tendon kind of pulling it down. So you've got these two tensile forces pulling the kneecap apart, and so with repetitive flexion extension or with a possible trauma, you can eventually develop a stress reaction along the patella that can turn into a fracture and cause an actual break. A stress fracture is a fracture that's a result of repetitive fatigue. It doesn't happen instantaneous. It's something that occurs over time as the tissue in the bone gets weaker and weaker and fatigues. There's two common patterns we see with these. One is where the fracture is vertical, but the more common is where it's transverse. And this is because of those two directions that the tendons are pulling on either side, basically causing the patella to split in half. I couldn't find official word if she's gonna have surgery or if they're gonna sit her out and immobilize the knee. In more mild cases, they'll just rest the knee, but sometimes you have to actually put a person in a brace that keeps the knee locked in extension so that you can limit that repetitive flexion and loading on the kneecap. But other times, if there's any displaced fracture, meaning things are out of align, they will have to go in and do surgery to essentially pin the patella back together. Sticking with soccer, I want to highlight a story that was just reported in The Athletic by Matt Slater, talking about some changes that could be coming down the road with FIFA regarding concussions. We all know how serious concussions can be, but unfortunately there's some sports that just don't have quite the robust concussion management and assessment protocols, and soccer is definitely one of them. There was an episode this past World Cup where a USA player and a player from the Netherlands essentially collided and butted heads, went down on the grass, obvious amounts of pain and discomfort, clutching their heads, came off the field, but then right away came right back in. This is something we have to keep from happening in any sport. And so the news is that apparently there's talk of switching to a mandatory 10-minute timeout period where the player has to go off the field and be evaluated off the field on the sideline, more like what we do in football or basketball. Currently, it's basically there's a 3-minute time period where they're evaluated on the field, and so things are very rushed. It's not a good thorough assessment, and you can't get everything done to assess for a concussion in that short 3-minute time period. There's a lot of other approval steps that this has to go through. I encourage you guys to go check out the story. I'll link it below. But this is a good step forward for concussion awareness and really trying to keep these athletes healthy. In other concussion news, moving on to the NFL, Sterling Shepard and the New York Giants were the subject of a little bit of controversy in news most recently in the league based on concussion management. The NFL is going to do a review of what might have happened during one of the Giants' game when it appeared from footage after the game that Shepard clearly suffered a concussion and had very concerning symptoms displayed on the field, but was missed in real time during the game. Shepard reported to the facility with symptoms the following day and ended up having to miss week 2 before now ultimately clearing through the concussion protocol and returning for this next week's game. Unfortunately, as good of a system as the NFL has at trying to spot concussions, no system is perfect and things are going to slip through the cracks. This looked to happen kind of away from the ball, and so it's not surprising that it was missed compared to something right where the action is. I will say there are a lot more people looking out for concussions in the NFL than you might think. There's basically a whole team spread out in different spots of the stadium monitoring for any concerning symptoms, any concerning hits, and then having the ability to radio down to the field to tell the officials that they need to remove a player and have them assessed. Typically in the replay booth above the stadium, you have an athletic trainer and you have an unaffiliated neurotrauma consultant who's a physician. You then have the athletic trainers on the field, you have the team physicians on the field, you have the coaches, you have the officials, and there's even an unaffiliated neurotrauma consultant on the field. So you've got multiple people in different settings reviewing different things to watch for. Last year, the NFL instituted a third unaffiliated neurotrauma consultant whose job it is to basically look at video footage and audio replay footage from the national TV feeds to again make sure we're not missing anything. So it's not like there's just one person on the sideline trying to watch for these concussions. They've done a pretty good job of putting people in different vantage points around the stadium with different tools at their disposal to review footage and watch for these injuries. No system's perfect, but this is great that the NFL is recognizing that something went wrong and is trying to implement a way to figure out what happened and correct it. Staying in the NFL, let's talk about what happened to two of the biggest star quarterbacks last weekend, Drew Brees and Ben Roethlisberger. Now, I covered them in individual videos, and make sure you go check them out here if you haven't seen them yet. But we since then have learned that Drew Brees underwent his surgery. It was reportedly very successful, and they're still aiming for a 6-week time period. Roethlisberger, on the other hand, we still haven't heard officially what exactly got hurt and what structure was involved. All the speculation, kind of including the highlight of my video on him, was about the UCL ligament, but we got news that he doesn't need Tommy John surgery, and we have to wait to find out until after the operation what exactly they had to do. I really thought we'd have this information by now, but it hasn't come out yet, and so unfortunately no specific updates based on what they had to repair, if there was any cool, crazy technique they had to use. So if we get that information, we'll certainly address it in the future. Moving on to New York Jets quarterback Aaron Darnold? No, okay, sorry. Sam Darnold. All right, I know you guys gave me a lot of heck because in my Drew Brees video, I said Aaron Darnold, thinking about Sam Darnold instead of Aaron Donald. So yes, Aaron Donald, Sam Darnold. Let's talk about Sam Darnold and his mono recovery. The report is that he's feeling much better and he's been cleared out of quarantine. He's back at the practice facility, still aiming for a week 5 return. Darnold confirmed that his spleen is enlarged, and that was our concern all along, talked about in last week's video. If you recall, I mentioned how the really kind of critical time period for a rupture of the spleen is about week 1 to 3. It's not necessarily the size of the spleen that puts it at risk of rupture. It's during the phase when it's growing that it's most susceptible. From previous literature though, a rupture after 4 weeks is pretty rare, and so based on when he was diagnosed, they're aiming for a week 5 return. It seems like this is about the 4-week time period that they're shooting for. Ultrasound is a really great tool that they can use to monitor the size of the spleen, but most players will return to sport when their spleen is still enlarged, but they're out of that serious window when it's at higher risk of rupture. Expect him either way to be wearing some additional padding over the chest and over the stomach when he does come back, just as an extra precaution. Last week in football, we saw 2 pretty bad ankle injuries, the first involving Florida quarterback Feleipe Franks, and the second involving Trevor Siemian of the New York Jets. These were 2 similar mechanisms, but different results. I talked about Siemian's injury in pretty good detail with slow motion review of the footage in a standalone video, and in his injury, he didn't have any bone injury, no fractures, it was just ligaments that were torn. People were amazed by how he was able to walk off the field and really didn't seem to be in all that much pain, despite the obvious dislocation to his ankle. Now, Franks, on the other hand, looked to be in excruciating pain whenever he had his injury, and his was in fact a dislocation plus a fracture. The fact that he was in so much pain is probably because of that fracture, and so you can see the 2 different scenarios here where how much that fracture can really contribute to the overall pain. We don't have any good footage of what happened with Franks other than seeing that his ankle got caught behind him and then twisted whenever someone landed on him, but nonetheless a really unfortunate injury, but as you could have seen, a different type of scenario from what happened with Siemian. Changing sports and moving on to the NBA, Isaiah Thomas was once again back in the news with an injury, this time involving the radial collateral ligament in his thumb. If you've seen my Drew Brees video, we talked about the ulnar collateral ligament, and the radial collateral ligament is simply on the other side of the thumb. This ligament is much more rare to actually injure, and so it's pretty surprising that this happened with Thomas. The report was that he injured it during a pickup game and is going to undergo surgery and missing anywhere from 6 to 8 weeks. The mechanism of how this often occurs is whenever the thumb gets jammed in some way, it causes that joint to deviate towards the ulnar side, which stresses that outer portion and stretches the radial collateral ligament to the point where it ruptures. But for like every 9 UCL ligament ruptures, there's only 1 radial collateral ligament rupture, so super rare, just based on the way our hands are positioned and the activities that we're doing with constantly having our thumbs knocked backwards. They estimate 6 to 8 weeks. Some of the research that I'm familiar with says more in the order of like 8 to 12 weeks. But things are always different depending on the surgery they have to do, how he heals and recovers, but don't be surprised if it's a couple more weeks than we might have initially been reported. Finishing up here, if you follow me on Twitter, you might have seen that I retweeted talking about this article posted in The Athletic about a Chelsea soccer player who they were thankful the x-ray showed no ligament damage. And I understand these reporters don't have medical background, but knowing that x-rays don't show ligaments is like basic pre-med type of knowledge. X-rays show bone really well. Now they can give us a clue about the ligaments based on spacing that we see between the bones, but I can't actually look at an ankle x-ray and identify exactly where the margins and the boundaries of the ligaments are. If you want to evaluate the ligaments, you've got to do something like an MRI or an ultrasound. So we've got to quit saying that x-rays don't show ligament damage because they're not supposed to show ligaments. Basic medicine 101 stuff here, guys. Hopefully by now people on my channel following know this because we've talked about it before. So that's it, everybody. Another weekly rundown complete. I hope you guys learned something again and still enjoy this format of what I'm covering. If I'm going too quickly on things, I'm just trying to make this video not too long, but I also want to give enough detail about what's happening so you can actually learn from it. We'll continue working out the kinks here, really trying to perfect this whole process. Also, let me know any thoughts you have about trying to name this. I want to come up with some sort of name for this weekly show that's not just weekly rundown of sports injuries. So let me know if you guys have any good thoughts. Otherwise, thank you as always for watching, everybody, and until next time, we'll see you later.